I guess that what I want to say this evening is more of a summary of what's been said today, rather than a specific issue. So what I just hope to cover, if I can, is just to consider, just for a little while, the National Health Service in the UK. It's now 72 years of age, and is, if not quite the oldest, it's certainly the largest universal health coverage system in history. I also want to think about what it is to learn, really, and what we need for our workforce of the future, and really consider whether the way in which we've traditionally taught people to become health professionals is adequate for what we need over the next 25, 30, 40 and 50 years. And to supplement that, I'm going to talk about my own particular job role, which is around global learning environments. And just to do a little bit of introduction, I'm Director of Global Engagement at Health Education England. You heard from Mark Radford earlier on today, who's the Director of Nursing at Health Education England. Health Education England is the workforce arm of the National Health Service, and we are responsible for ensuring that the workforce is of the right quantity and the right quality to deliver the care that our population demands. So thinking about the NHS at 72, we obviously are faced with a series of real difficulties, and we have a population which is getting older, and people who get older are developing more and more chronic disease, and it's not uncommon to see quite fit 80 and 85-year-olds who have managed a whole series of diseases over a lifetime. Certain non-communicable diseases like diabetes are rising. We know about the problem with obesity, which is not just a problem of adulthood, but also of young people. And the complex morbidity, of course, is matched with the fact that people are not dying as early. Because of the demands on the National Health Service, we have ended up in a position where we have a significant nursing and doctor shortage. And you don't need me to tell you, because it's all over the news at the moment, that as well as the current unprecedented, really, global pandemic, we're also about to face the pressures of a winter. This, of course, will always lead, and we've heard earlier on today, to issues around mental health of staff, and never has it been more important for us to think about how to look after our own staff. We are, of course, not alone. The World Health Organization thinks that we're likely to need to train an extra 12.9 million healthcare workers by 2035 worldwide. And just to give you an example, in India, they believe that they need to train 3.5 million healthcare workers before 2022, because the demand is doubling 2 or 3 times in every generation. Our current workforce is really huge, and I'm enormously proud. I'm a surgeon by profession. In fact, still practice 1 day a week, and I'm incredibly proud of working in such an incredible organisation. If you think about what the NHS does, it delivers care free at the point of contact to some 60 million people, and has done for 70 years. It employs about 1.3, 1.4 million people directly in over 200 different professional groups. We have over 100,000 doctors, 350,000 or so qualified nursing staff, as well as vast quantities of allied health professionals and scientific staff. It is an incredible piece of machinery which manages to achieve some of the highest outcomes in terms of treatment of disease anywhere in the world. So fundamentally, I'm a medical educationalist, and that's where my background lies. So I just want to ask you to consider a couple of truisms, really, about learning. The first of these is that if you read any book about learning, they will tell you that there are 3 components to it. The first is the curriculum, which is what we learn. And we're all very familiar with curricula. We've been used, no matter what stage in your career or education you are, you will be very much aware of curricula. But actually, in healthcare particularly, curricula is only a very small part of our learning. And we know from studies that the most important thing in developing health professionals, or the two most important things in developing health professionals, are the person who they watch and observe and who directly interacts with them in a day-to-day basis. And perhaps more importantly, the clinical environment in which they learn their trade. And it doesn't matter whether you're a speech therapist, an art therapist, an allied health professional, a paramedic, a doctor, or a nurse. Your clinical experience of learning is the thing that will have the most powerful effect on you in terms of your working life. Now, this is a little bit of a complicated diagram, but I suggest to you that you've heard many very successful healthcare professionals during the course of the day. And many of them, and our last two speakers were no different, showed images of when they first qualified and made comments about the clothing and what was required and the number of healthcare professionals around and what healthcare professionals did. And every one of them acknowledged that their job had changed completely beyond recognition over this period of time. And so there is no reason to suppose, in fact, there's every reason to suppose that the rate of change that we expect of our healthcare professionals today is increasing all of the time. So if we teach somebody a skill now, it's almost certainly not going to be the same skill that is required in 5 years, and definitely not the same skill or group of skills that are required in 20 years. And increasingly, we at Health Education England have recognised the importance of equipping people for a change in healthcare environment. And you'll notice that the circle on the left tries to sum this up. And we've spent, I guess, the best part of 400 years, certainly in medicine we have, and certainly 200 years in nursing, teaching people competencies and skills, the outside bit of this circle. But we're increasingly aware that it's actually the inner circle that is most important. We need to equip our healthcare professionals with emotional intelligence, with an ability to lead, with an ability to be culturally sensitive and competent, to be resilient, to be able to adapt to resource changes and resource poor settings, to communicate well, and that whole notion of flexibility, so that whatever is required of the healthcare system in 2, 5, 10 or 25 years, we have a workforce that can adapt to that requirement. Now, one of the things that we have become increasingly aware of is that in order to excel as a health professional, it is insufficient just to be exposed to teachers and learning environments within the NHS. And increasingly, we are understanding that in order to create a healthcare professional with all of those metacognitive skills that I mentioned, like resilience and adaptability, we need to extend their learning experience to other learning environments, not just other learning environments within the UK or our own country, but actually learning environments within other countries, other healthcare economies, low, middle, emerging economies, and other Western economies. We have recognised that by doing this, our healthcare workers improve their productivity. We can improve recruitment, and I'm going to give you an example of that in a minute. We know that, I come from the cusp of the baby boomer generation, X generation, who think about their careers very differently from those people who were born within the millennial generation and Generation Y. And we recognise that there is much more of a shift towards portfolio learning, where individual learners really want to experience as much as they possibly can during a lifetime of learning. So as a consequence, global learning and working within a global context is in more demand. We know, and there's increasing evidence, that those skills that we want to develop are developed more efficiently when you are put out of a standard comfort zone of a clinical learning environment within the NHS and inserted into another healthcare economy. It's also a cost-effective way of treating our staff, and it increases their satisfaction and prevents them from leaving the profession. So what I'm going to do is I'm going to give you 3 examples of global learning, and hopefully they will interest you. And if you are interested in a health professional, you have to, I think, come to terms with the fact that it is highly likely that both during your training and in your postgraduate practice that you will be asked and encouraged to change your healthcare learning environments to global learning environments at certain stages during your career. So the first example I'm going to give you is a short video. It's only 3 minutes long, and it gives an example of a program that I personally have been involved in now for over a decade. Can we roll the video, please?
The Global Health Exchange was created by Health Education England. A combined think tank and incubator, our job was to explore how to support the NHS workforce through global learning. It's hard for health professionals to be world class if they only learn in their local area. So we had an idea. What if by giving professionals international experience, we could help grow the NHS's contribution to global health at the same time? It was a complex vision, but the model we designed was simple. First of all, we would partner NHS organisations with healthcare organisations in lower income countries. Then we would recruit a mix of long-term volunteers, short-term volunteers, trainees and undergraduate learners to visit them. They would share expertise and develop key skills, whilst also arranging for staff in those countries to visit the NHS here. Working alongside partners such as the Tropical Health Education Trust, Global Health Exchange has helped to make that idea a reality with amazing results. One of the best examples is northern Uganda. After the ceasefire in Gulu in 2007, staff at the only hospital were ready for some help. Global Health Exchange set out to help them get back on their feet and drive down the high neonatal and maternal mortality rates. Since then, around 400 NHS staff had visited as volunteers, trainees or learners, expanding their professional knowledge and personal development and bringing those experiences home. We've collaborated with Canada, the USA, Australia, Denmark and Italy to bring strong relationships with the local community and welcomed hundreds of Ugandan healthcare professionals to work and learn with us in Manchester. But most importantly, we've helped reduce neonatal mortality from 90 per 1,000 to 40 per 1,000, and maternal mortality from 300 per 100,000 to less than 100. NHS patients have benefited from the knowledge, skills and competencies our staff have brought home from Uganda. We're now measuring and evaluating this to do even more in the future. The Global Health Exchange has a wide range of opportunities for NHS staff of all ages and backgrounds. So if you'd like to develop yourself in your career by working on one of our projects, get in touch. And if you'd just like to find out more, visit globalhealthexchange.co.uk.
So 2 very quick other examples before I finish. We have had a problem in the UK recruiting general practitioners. General practice training is a 3-year program. So one of the things that we have offered is a 4-year training program where year 3 is spent within Africa, delivering healthcare in the community in Africa. We have managed to attract several hundred extra GPs per year through this program. And then finally, global learning, of course, occurs in both directions, and we have started to attract significant numbers. In fact, there will be well over 800 nurses this year and several hundred doctors on similar global learning pathways coming into the NHS to learn about the NHS, how the system works, and how we in the UK deliver healthcare, so that experience and learning can be taken back to their own countries. All of these things are done with educational partnerships, and we haven't got enough time to go into these, but having a partners or multiple partners with institutions and regions across the world creates a co-development spirit, so that through global learning, both health systems are strengthened. And the final thing really I wanted to say, and this is unique about healthcare, is that if you look at world expenditure on healthcare, we spend about 75% of it on human resource, on our workforce. And that, if you think about pharma or defence or the financial section, only about 15% of their expenditure is on workforce. And the reason for this is because healthcare is focused specifically on people. And not only on people, but also on relationships. So I am absolutely delighted to have been honoured really to talk to you all today. I'm very, very excited about those of you who are going to enter the profession, and those of you who have spent all day listening to some really quite amazing journeys. And I just want you to bear in mind that we as people in the UK are not the only people who are facing problems, but actually through sharing those problems, we can become the health professionals that are required for the globe and for the NHS in the future. Thank you.